What's up? I'm Andrew Rogan, and this is the Whirlpool. You can use cold or warm, depending on whichever one you want to use. The effects for the Whirlpool are they decrease swelling, pain, muscle spasm, and it assists in the active movement during cryo or thermotherapy. Some of the indications for the Whirlpool are peripheral nerve injuries, peripheral vascular disease, decreased range of motion, and subacute or chronic inflammatory conditions. Contraindications are open wounds, heat on acute injury if using the warm Whirlpool, or using the warm Whirlpool on someone who has a fever. So you can bring it a little bit closer. So when you're setting up the Whirlpool, if you're going to use the cold Whirlpool, the temperature needs to be set up with 50 to 60 degrees Fahrenheit. If you're going to use warm for an extremity, it needs to be 105 to 112 degrees Fahrenheit. And if you're going to use the warm Whirlpool for a whole body, it needs to be 100 to 108 degrees Fahrenheit. So you would start by inspecting the area of skin that's going to be treated. So we're going to treat his ankle. So I'll just check, make sure there's not any open wounds or anything like that. And then after that, we're going to position the patient in the Whirlpool, which means we're going to bend his leg and put it in there and make sure that the injury is 8 to 10 inches from the jet. The jet's right here and it just goes straight down. So it needs to be 8 to 10 inches from that. And then we just turn it on. And I'll keep it on for the whole thing because it's too loud. But typically the treatment time will be 15 to 20 minutes and I'll check on them every 5 minutes. So after that, you just take them out. And I would dry. And inspect the skin. And then after that, we would drain the Whirlpool. A few advantages for the Whirlpool are that it can reach irregularly shaped areas and it can be used simultaneously with massage. Some disadvantages are you can't isolate small areas and you cannot elevate it during this treatment. Precautions are you should always use a ground fault interrupter in case the electrical current starts flowing through the water or the person. You should also warn the patient that the water motion may cause nausea, and the person in the Whirlpool should always be supervised and should never be allowed to turn the Whirlpool on or off. That's pretty much it. So, yeah.